Good afternoon. Today we are at IMA Sirampur, Hooghly branch, and it is in the program of Your Health, Our Thoughts, and we'll be speaking about shingles. And I am Dr. Abhigyan Ghosh. I have completed my MD in pharmacology from PG Hospital, Kolkata, and currently working as assistant professor in the Tomluk District Hospital. And with me, I have Dr. Dipan Saha. He is pursuing his DM in clinical pharmacology from tropical medicine. So, without further ado, let's start our talk today. That is about shingles. Now, shingles is a debilitating illness. It is a very painful and debilitating illness that affects millions of people worldwide each year. And though it is very common, but still the awareness throughout India is very low about this disease. Actually, it is caused by the varicella zoster virus, which is a member of the herpes family. It is a DNA virus, and the thing that happens in shingles is that a person, if he contracts chicken pox, he or she contracts chicken pox in his younger days, then that virus lies dormant inside the body, in the nerve roots, and in his or her elder years, this virus gets reactivated, and this may give rise to shingles. So, what are your thoughts, Dr. Saha, about this disease?
Yes, I would like to highlight one point, that the very same virus that is called varicella zoster, which is known to cause chicken pox in the childhood or in adults in some cases, the same virus is responsible for the development of shingles. We all know that. The person who gets affected by chicken pox, by varicella zoster, and after he or she gets cured, the same virus lies dormant in different nerve root ganglion in the body. And later, whenever the person is sick or due to some reason, it could be some medications like corticosteroid or any other immunosuppression drugs or any other factors like advancing age or any other thing, the same virus gets reactivated and represent with the development of shingles. And the presentation of shingles will be along with the same nerve root ganglion where it is hidden for last few years or so. So the person will be having painful blister-like conditions, and along with that he or she could have fever, malaise, in some cases photophobia and other symptoms, and the pain or the appearance of rashes will be usually unilateral. That means it will affect only one side of the body in most of the cases. There are some exceptions, and also we have to be aware about different complications of shingles, because once the person is cured and free of symptoms like the burning pain, the tingling sensation, fever, but that some amount of pain may persist for many years in the coming time, and that tingling pain or the burning pain which will persist for the later years, that will be called as post-herpeutic neuralgia. And we have different approaches for the treatment, and how we can prevent, we also need to know that. And also we have to remember, when the patient is affected by the varicella zoster and is suffering from shingles, that time we have to remember it is the contamination may occur, and person to person transmission also may take place. The person who has never had chicken pox in the childhood, if he comes in touch with the person who is affected with shingles, that person can develop chicken pox. So you can continue with the later part like treatment and other approaches.
Right. Rightly said, as Dr. Shah was rightly telling. And these painful blisters are the actual, these are not only cosmetic issues, but this may also present to several life-threatening conditions. Like this can cause facial nerve paralysis. This can even be, in some cases, this can cause unilateral blindness also. So the rashes generally do not cross the midline, but there have been reports of exceptions in some cases. There have been, it actually follows the dermatome, as like a dermatome mapping, we say, that it actually follows the nerve roots in such a way that only the nerves in which the virus is lying dormant is activated. And regarding post-herpetic neuralgia, we have several pharmacotherapeutic approaches to reduce the pain. Of course, corticosteroids are a no-no in this case. We go with several medications like pregabalin, nortriptyline. Nowadays, these are the combination is available to reduce the pain, and also NSAIDs may over-the-counter NSAIDs may provide some amount. Opioids may also provide some amount of pain relief. But the awareness as a whole, the perspective as a whole of shingles is lacking in the population. So nowadays, various companies are researching on shingles, and they have developed vaccines which give up to 90% of protection, as we all know. But these have been developed in the developed nations. In developing nations like India, we are still lacking. As I said, the funds are lacking, the awareness is lacking. So what's your take on how can we actually sensitize our population regarding the shingles and the vaccine that is available, so that the protection can be given to the
Yes,
mass?
this is definitely a good thing that recently we have got the vaccine against shingles. And what CDC recommends, they recommend that any person 50 years or older can receive the vaccine which is developed by recombinant DNA technology to prevent shingles. And regarding adult patients or adult subjects, yes, they can take any person above 18 years of age, but due to some reason he is not immunocompetent, like if the patient has received any organ transplant,
Right.
or receiving any immunosuppressant drug for any conditions, be it rheumatoid arthritis or any other autoimmune diseases. In that case, also the younger one, like 18 years or more, those patients also can receive shingles vaccine. And we have to remember the vaccination against varicella zoster, that means the chickenpox vaccine status has got to do nothing to do with this. If the patient or the subject was vaccinated against chickenpox in the past, he or she still can take this vaccine against shingles. And usually 2 doses are recommended. After taking the first dose, between 2 to 6 months, the second dose should be repeated. And one more thing, we have to also be careful about the symptoms, because as soon as the symptom appear, in sometimes if we start antiviral therapy, acyclovir or any other drug, it might be helpful in some cases. And so the symptoms usually present or different, they are divided into 3 or 4 different phases. At first, the patient will have some abnormal sensation on the skin, along with fever, malaise, joint pain, and then the rashes will appear. At first, it will be like red and papular rashes, and it will be followed by some blister-like conditions, blister-like rashes, which will be filled with some fluid, and gradually these fluids will be coming out of the blister and crusted out the whole thing. And at this stage, the transmission from person to person is very high. You have to remember, and you have to isolate the patient, or you have to be in self-isolation for the prevention part. And also we have already discussed about the vaccine. And as soon as the rashes appear, if you think that treating physician thinks that it is shingles, we can initiate pharmacotherapy with antiviral, and in some cases to reduce the pain, we can take help of drugs like gabapentin, pregabalin, or any other like opioid or TCS.
Very well. So that was in a nutshell everything that we need to know about shingles. But the protocol that we can develop, actually, we can jolly well include the shingles vaccine in our vaccination protocol. Like the India's search for this vaccine in the younger age group, even in people who have had chickenpox. For them, if the shingles vaccine is made mandatory, we can go from schools to schools, from localities to localities. People who have been affected with chickenpox, or people who have not been actually subjected subjected to this disease as a whole. So this vaccination may play a very important role in the near future in the prevention of shingles, as this is a very painful disease, as we have already mentioned previously, and it can also actually cause some life-threatening conditions in the adults, especially in the immunocompromised, as you rightly pointed out. So I think it is on us physicians to sensitize our patients and our localities as to the benefits of getting the vaccines for shingles before. So as we all know, prevention is better than cure. So would like to prevent the disease as a whole rather than cure it with pharmacotherapy interventions. Regarding the mortality, actually shingles is generally not that life-threatening, but there have been reported cases of mortality to the tune of around 3 to 4 patients per 1,000 population. Generally, the mortality is found in the groups who are compromised, who are immunocompromised, who have some kind of renal failure or some kind of they are on some kind of cardiovascular drugs as a whole. So that is one thing. And what is the solution for this, and what is the take-home message that you are trying to give to the mass?
Yes, I would like to point out that the mortality is not as high as other diseases, but still it is a very painful condition, and some of the complications we already discussed about earlier, like it can affect the optic nerve and can lead to blindness also.
Right.
That is very life-threatening,
Right.
the blindness, and also the person will be disabled. And in some of the cases, the patient might develop some vestibular illness also, if the vestibular nerve gets affected, and
Right.
some deafness and some other concomitant conditions may develop due to that. So that is, I think, related to that Ramsay-Hunt syndrome. That is very much related to Ramsay-Hunt syndrome. And so to prevent this kind of complications, which may not be life-threatening always, but can make the person disabled, and the quality of life will be compromised due to that. So right now I would like to say that since the vaccine is developed, so there is a definite way to prevent shingles and reduce these complications by giving vaccines and make the people aware about that. Like nowadays we are recommending the immunocompromised patient or the patients with bronchial asthma or COPD to take influenza vaccine or pneumococcal vaccine routinely, and clinicians are aware, they are spreading that same thing among their patients. So the same thing should be done regarding shingles also. So the varicella zoster vaccine is with us, so we can we can make the patients as well as the treating physicians aware about the vaccine and the pros and cons of the vaccines. There are not many adverse effects related to the vaccine which is developed towards shingles. Only some the pain at the site and some malaise or fevers, only limited to that. So we have to make the people aware about the symptoms of shingles and the benefit of self-isolation during the period, and also have to make them understand the benefit of the vaccine, and especially among the elderly population. That is important. And with that we can minimize the shingles and that related complications also. So I think with this we can conclude our session for today. Thank you.
Thank you. So on behalf of Srirampur Betarbani, we'd like to conclude the session today. Thank you to Dr. Shaha and myself, Dr. Ghosh. And it was a pleasure for both of us to be present here today to speak to all of you. Looking forward to several such sessions in the near future. Thank you very much.
Thank you.